For Montana East Regional News, this is Emily Boyles. Some big news coming from Glendive Medical Center. I'm with two GMC officials, Laura Glueckert, who is the board vice chair, and Parker Powell, the interim CEO.
Thank you, Emily, for having us. The board of directors, I am on their behalf excited to announce that we have signed a formal affiliation agreement this week, concluding a 3-year process to structure a new governance arrangement between the two organizations. Around 3 years ago, the board brought up the idea for sustaining good quality care in rural Montana to explore the collaboration process. And with that, we started the process of finding who would be the best fit for us. And we talked with many entities, and the direction with Billings Clinic seemed to be the appropriate fit. And so we explored and had many conversations with them. Also met with other affiliates that had signed on with them in the past and got to understand the processes they went through. With that, then had some community involvement, some employee involvement. Met with Billings Clinic many times. Then went through our due diligence process, a complete and thorough due diligence process. Decided then to sign with them for a management agreement and the shared governance. And so with that comes some many positive things for GMC in our community.
One of the first things that comes to mind when there's change in a community's the status of a community's medical center is, will the patients notice any change in the immediate? And Parker Powell, CEO of Glendive Medical Center, is also with us. Parker, can you kind of address that?
Yeah, you know, I think this is an exciting time for everyone that's associated with our organization, and I think the real benefits will be seen in the months and years ahead of us. As
far as the doctors that patients will see, or the billing process, those kinds of things, will there be any changes in the day-to-day operation?
And correct. I think as we work together on continue to the excellent quality care of services that we offer here locally in Glendive, and either through creating new service lines or working together at our current service lines, as we work together to gain more efficiencies over the next several years, we're going to see tremendous opportunities here for our patients continue to receive high quality care.
Laura, anytime there's this kind of a change, or when two organizations come together, generally board members get shared between two organizations. What agreements or how will that work?
The board consists of 11 members, and with that, Billings Clinic, we have proposed that they bring on 2 board positions, and with that, then the communication lines will be in both areas, and they will bring in insight from Billings Clinic, as well as we have a lot to offer them in the rural setting on needs and expectations, and really the desire for our area and our patients to stay local and maintain a high quality service, extend our service line, as Parker said, provide additional specialties coming in the future. You know, all these things are what I believe a community member is looking for, in the confidence that we have a health care facility in our town. Health care in the future is a scary path for small hospitals, and with that, the collaboration and pairing up and partnering up with a larger entity will ensure services locally. As keepers of the mission, as a board of directors, our mission is to provide and have a confidence in the community that our medical center is there for them and of the utmost quality.
When will this agreement, or has this agreement now become final?
Our board met last Wednesday in a special session, approved the affiliation, and Billings Clinic Board of Directors met last Tuesday and approved affiliation on their end, and it's likely that we would start this at the beginning of our next fiscal year, which would be in July.
GMC's affiliation agreement covers a wide spectrum of ways to collaborate that are intended to enhance patient care in Glendive and the surrounding area. Billings Clinic and Glendive Medical Center will work jointly to recruit additional physicians to expand access and clinical services for the Glendive region. They join 9 other healthcare organizations in Montana and Wyoming that are affiliated with Billings.